Hey guys, welcome to this YouTube channel. So if you're new here, kindly subscribe. If you have subscribed, thank you very much. Returning subscribers, thank you very much. And we want to talk about polycystic ovarian syndrome. Polycystic ovarian syndrome. So polycystic ovarian syndrome, what we know or what we call as PCOS is a hormonal imbalance that occurs when your ovaries create excess hormones. If you have a PCOS or polycystic ovarian syndrome, your ovary produce unusual high levels of hormones called androgens. This causes your reproductive hormones to become imbalanced. As a result, people with polycystic ovarian syndrome often have irregular menstrual cycle, and they can also have missed period and unpredictable ovulation. Small follicle cysts may be visible on your ovaries on ultrasound due to lack of ovulation. However, despite the name polycystic, you don't need to have a cyst on your ovary to have PCOS. The ovarian cysts are not dangerous or painful. So, polycystic ovarian syndrome is one of the most common causes of infertility in women and people assigned female at birth. It can also increase your risk of other health conditions. Your healthcare provider can treat a polycystic ovarian syndrome based on your symptoms and if you wish to become pregnant. So, what age? Let me answer this question. What age does polycystic ovarian syndrome start? Women and people assigned female gender at birth can get polycystic ovarian syndrome anytime after puberty. Most people are diagnosed in their 20s or 30s when they are trying to get pregnant. You may have higher chances of getting polycystic ovarian syndrome if you have obesity or if other people in your biological family have polycystic ovarian syndrome. So what are the signs and symptoms and also what are the causes? So let's start with the signs and symptoms of polycystic ovarian syndrome or PCOS. The most common signs and symptoms of polycystic ovarian syndrome include: number one, irregular period, abnormal menstruation, irregular period, abnormal menstruation involving missing period or not having a period at all. It may also involve heavy bleeding during periods. Number two, abnormal hair growth. You may have excess facial hair growth or experience heavy hair growth on your arm, on your chest, on your abdomen, and this affect up to 70% of people who are having polycystic syndrome. Number three, acne. Polycystic ovarian syndrome can cause acne, especially on your back, chest, and face. This acne may continue past your teenage years and may be difficult to treat. And the next point is obesity. Between 40 to 80% of people with polycystic ovarian syndrome have obesity and have trouble maintaining a weight that is healthy for them. The next point is darkening of the skin. You may get a patches of a dark skin, especially in the fold of your neck, armpit, groin, and under the breast. This is known as acnothosis nigricans. Acnothosis nigricans. The next sign is a cyst. Many people with polycystic ovarian syndrome have ovarian cysts that appear larger or with many follicles, and it can be seen on ultrasound. A skin tag. Skin tag are little flaps of extra skin. They are often found in the armpits or on your neck. And the next sign is thinning of the air. People with polycystic ovarian syndrome may lose patches of air on their head or start to be bald. And then the last sign is infertility. Polycystic syndrome is the most common cause of infertility in people assigned female gender at birth, not ovulating regularly or frequently, and can be as a result in not being able to conceive. So the next question we're gonna answer is, can I have polycystic syndrome but not have any symptoms? Yes, it is very possible to have polycystic syndrome and not have any symptoms. Many people don't even realize they have the condition until they have trouble getting pregnant or have gained weight for unknown reason. It is also possible to have mild polycystic syndrome where the symptoms are not severe enough for you to notice. The next question we're gonna answer, what is the main cause of polycystic syndrome? The exact cause of polycystic syndrome is unknown, and there is evidence that genetic play a role on it. Several other factors, most important obesity, also play a role in the cause of polycystic ovarian syndrome. Higher level of female hormone called androgen can also be a cause. Insulin resistance. An increase in insulin level causes your ovaries to make and release male hormone, that is the androgen. Increase male hormone suppress ovulation and contribute other symptoms of polycystic syndrome. Insulin help your body process glucose, sugar, and use it for energy. Insulin resistance means your body does not process insulin correctly, leading to high glucose level in your body. Not all individuals with insulin resistance have elevated glucose or diabetes, but insulin resistance can lead to diabetes. Having overweight or obesity can also contribute to insulin resistance. An elevated insulin level, even if your blood glucose is normal, can indicate insulin resistance. And another cause is low-grade inflammation. People with polycystic syndrome tend to have chronic low-grade inflammation. Your healthcare provider can perform blood tests that measure levels of C-reactive protein and white blood cells, which can indicate the level of inflammation in your body. So another question that we are going to answer is, can polycystic ovarian syndrome cause a miscarriage? Having polycystic ovarian syndrome may increase your risk for certain pregnancy complications, although most women and people assigned female at birth with polycystic syndrome are able to successfully carry a pregnancy to term. Other complications of polycystic syndrome related to pregnancy include increased risk of gestational DM, preeclampsia, and high blood pressure in pregnancy, preterm birth of before 37 weeks, or C-section delivery due to obesity, diabetes, or blood pressure. Diagnosis of this polycystic syndrome. In most cases, your healthcare provider can diagnose polycystic syndrome after an examination and discussing your symptoms. They may order blood tests or perform an ultrasound to help with diagnosis. Your healthcare provider will talk to you about your symptoms and medical history. Ask about your biological family and medical history. Check your weight and blood pressure. Perform physical exam for looking specific for excess facial hair loss, acne, discolored skin, and skin tag. Perform pelvic exam to look for other causes of abnormal bleeding, and then order tests to check hormone level and glucose level. Perform a pelvic ultrasound to look at your ovaries, check the thickness of your uterine lining, and look for other abnormal bleeding. So there are 3 symptoms to diagnose polycystic syndrome, and these are irregular or missed periods, Some people with polycystic syndrome have very heavy bleeding when they do have period. Another signs of signs of excess androgen, such as acne or excessive hair growth, or blood tests are confirming high androgen level. And then we have enlarged ovary or polycystic appearance of ovaries on the ultrasound. Many people don't develop cyst. Management. Let's talk about management, if it is manageable, and treatment. How is polycystic ovary syndrome treated? Your healthcare provider will determine treatment based on your symptoms, medical history, and other health conditions. And if you want to get pregnant, treatment can include medication, lifestyle changes, or a combination of both. If you don't plan to become pregnant, treatment include hormonal birth control and insulin sensitization, and then medication to block androgen, and then lifestyle changes, because we have seen most causes or one of the risk factor is obesity. If you want to become pregnant or in future, treatment for polycystic syndrome include drugs to induce ovulation, surgery is a procedure that can help restore ovulation by removing tissues in your ovaries that produce androgen. And with a newer medication available, surgeons rarely perform this because we have some medication that can induce ovulation. And then in vitro fertilization, this is an option for people with the polycystic syndrome when medication doesn't help with ovulation. Your provider fertilizes your egg with your partner's sperm in a lab before transferring it to your uterus. Does polycystic ovarian syndrome ever go away? Well, there are not no no, no there 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 well there are or there is no cure for polycystic syndrome. A healthcare provider can help you manage your symptoms. The effects of polycystic syndrome may change over time so that you become less aware of the condition. However, there is not a treatment that permanently cure it. So, can you be in menopause and have polycystic syndrome? The hormone changes you experience during menopause often resolve the symptoms of polycystic syndrome. If it doesn't matter how old you are, if your symptoms affect your quality of life, talk to your healthcare provider. Can I get pregnant if I have polycystic syndrome? Yes, you can get pregnant if you have polycystic syndrome. Polycystic syndrome can make it hard to conceive while also increasing your risk for certain pregnancy complications, and that those things we have already talked about them. So let us talk about prevention. Can I prevent polycystic syndrome or its effect? There are no proven way to prevent polycystic syndrome, but you can take small steps to reduce your symptoms. For example, eating nutritious food, exercise regularly, and managing a healthy weight for your body can help you avoid the effect of polycystic syndrome. So I think we are going to stop there. Let's meet in the next video. Let me know what you want me to talk about in the next video in the comment section.